And this little guy? Thyroid. And this one? Cricoid. And this? Epiglottis. And the actual split is what? The glottis. Okay? I can't really ask vocal cords because this just, it doesn't do anything for me here. What are these? Arytenoid, and these are corniculate. That's it. Okay. This is what?
Primary bronchi.
Primary bronchi, secondary, tertiary. Okay? That's that one. All right? You know that this whole area is what? Nasal cavity. Okay? And this is the external nares or nostril, right? And this is frontal sinus. Okay? This is what? Sella turcica. Remember, that's in the sphenoid bone. So this is a sphenoidal sinus, isn't it? Remember, a sinus is a cavity, an enclosed cavity. These are what?
Nasal conga.
The conga. And so this one would be inferior, middle, superior. Okay? This is auditory tube. Okay? This is hard palate, lips, teeth, tongue. Well, that's the tongue. What's the cavity? Oral cavity.
Is it proper, or do you have to say it?
No. This is the tongue. So this is the, did you tell me hard palate? Soft. And this specifically? Uvula. Okay. Uvula. This area would be what?
Pharynx.
The pharynx. Okay? No, I'm not going to ask them specifically.
That's like where they.
Okay? This whole thing is what?
Capsule.
Kidney.
A kidney. And this is the,
Capsule.
which capsule?
Renal.
The kidney capsule.
Kidney capsule.
This is the renal capsule, okay? So this is the kidney capsule. This portion of it is the cortex. And you know that because what are these little round guys? They're these. What are these?
Corpuscle.
Renal corpuscles, okay? So this is a pyramid, and at the end, this is the papillae. And coming down between the pyramids, you have the renal columns, okay? And this is minor calyx, where you have more than one of those together. You have major, where you have more than one of the majors together. You have the pelvis,
And then the
ureter, okay? Do you have the sheet for this?
Yes.
It's a separate sheet. There it is. Okay? All right? So is there anything else that you need on this?
Well, that's.
On this? Okay? Okay? So this is essentially a lobe, okay?
I'm sorry, the arteries and the veins,
Yeah.
which.
We're going to go over them
Okay.
in class, and after we do that, then I'll go over them, okay? From here up is what? The cortex. So this is the medulla. This is what part of the nephron?
renal corpuscle.
The renal corpuscle. This is the proximal convoluted tubule. It's proximal to this. So this is proximal convoluted tubule. It's proximal to the glomerulus. okay? So proximal convoluted tubule, what is
Loop of
this?
Henle.
Loop of Henle or nephron loop, okay? This is the
Distal.
distal convoluted tubule. You can't just say distal and proximal because I'll only give you half credit. And this is collecting duct, okay? So the parts of the nephron, again, are the
Renal corpuscle.
renal corpuscle, the proximal convoluted tubule,
Loop of Henle. Distal.
distal convoluted tubule, and the
Collecting
collecting ducts, okay? And so this portion is the what?
Renal papillae.
Renal papillae. And so it's dumping into what?
The minor calyx.
Minor calyx, okay? Now, over here, you have the actual filtration mechanism, the renal corpuscle. And you have, the whole thing is renal corpuscle. On the outside here is the what? Renal capsule. Inside you have the actual glomerulus. It's fenestrated capillaries on top of which sit podocytes. Okay, so if I say, what are the white things? You're going to tell me podocytes. Okay? This is the afferent arteriole, so this is how the blood is coming in. This is the efferent arteriole, that's how the blood is going out. This is the proximal convoluted tubule. This is the distal convoluted tubule. Now it has to be there, and it has to be there because you can see that some of these cells look different than these, right? And some of these cells look different than these. That's because these have been, the afferent arteriole cells have been modified, as have the distal convoluted tubule cells been modified. Right here, that's called together the juxtaglomerular apparatus or complex.
The whole, like,
The whole thing.
Afferent.
That
The
whole little
afferent
thing.
and
Efferent.
the distal convoluted tubule.
Okay.
The modified cells of both of those structures are called the juxtaglomerular apparatus.
Yeah,
Okay?
yeah, so- yeah, afferent, the whole thing together is-
Okay? Now, you have also reproductive models
yeah, where are they?
that you need. I don't know where